and a senior scientist at the Ottawa Hospital Research Institute.
Today we have Dr. Graham speaking to us today about the knowledge to action cycle. So we're excited to kick this off. I've got 5 questions listed out that we'll be going through. So my first question for you today, Dr. Graham, is can you describe in a few sentences how the knowledge to action framework came about and how it is used now?
Sure. So the knowledge to action framework is actually a planned action framework, and these are also sometimes known as process models or frameworks because they break down the change process into manageable components. And in keeping with Roger's work on the diffusion of innovations, the purpose of these models or frameworks is to influence the decisions and behaviors of a group. And around 2003, 2004, a colleague, Dr. Joe Logan, who was the Director of Professional Development at the Ottawa Hospital, and I applied to the Canadian Institutes of Health Research to do a synthesis and a theory/concept type analysis of planned action models. And so we knew of a handful of them. For example, Tytler's Iowa model, Stetler's model. We had published the Ottawa Model of Research Use in 1999, and we knew of a few others. So we thought it would be a fairly easy project to undertake, and we put in the grant proposal, and we were surprised that it was chosen. And so we got the grant, and we started searching for planned action models, and we stopped looking when we had reached about 31 of them. And we figured we probably had saturation. And they came from health and social work. I think there was one even in the area of engineering and firefighting, very diverse areas they came from. And so our analysis, which did that synthesizing of the components of these other people's planned action models, really became a meta planned action framework.
Awesome. And to expand on these components, can you describe those components of the knowledge to action framework?
Sure. And so you can see the knowledge to action framework there on the screen, but there's a few assumptions that I think are important to kind of quickly run over. So generally, the notion that there are people who produce knowledge, so researchers, and people who use knowledge, and we'll call them knowledge users, and that both these groups of people, and sometimes they're the same person, or they have both roles in the same person, are situated in a social system, or sometimes it's multiple systems, the healthcare system and the social care system, for example. And these systems are responsive and adaptive, although not always in predictable ways. And so the knowledge to action process is considered iterative and dynamic and complex, and that the boundaries between knowledge creation and action are actually fluid and permeable. And the framework falls within a social constructivist paradigm, which essentially means that it privileges social interactions and adaptations of knowledge and evidence and takes local evidence and context and culture into account. And so we learn things by interacting with others in the process. And so that's kind of one of the strengths of the framework. And each of the phases of the action cycle can actually incorporate all sorts of other psychological, sociological, educational, organizational theories. So it really is a larger framework in which you can embed other theories as you go. So as you can see in terms of the figure, there's 2 components. There's the action cycle, which is around the outside, and that was derived from 30 of those planned action models or frameworks. And I mentioned there were 31. One of them we couldn't make sense of. So the analysis was actually based on 30. And if I can draw your attention to the bottom, you see identify the problem, and then identify, review, and select the knowledge. And in between the two is define the no-do gap. So of these 30 models, some of them started with, what do you do if you have a problem? And then the next step is you need to find a solution, evidence, knowledge that would address your problem. Other ones actually started the other way around. It started with, here's the solution. So there's a practice guideline that's come out. Do you have a problem? Are you practicing in keeping with the guideline? So that's why the 2 of them are in the same box. and they start at the bottom. But the key piece is actually the evidence practice gap, because that's what triggers whether you actually do anything about it. So is practice in line with the evidence, or is policy in line with the evidence? And the group needs to decide whether it is. And if it is, then you don't need to go any further. You can look for another issue or problem to deal with. But if they decide, yep, we have a problem, there's a gap, and we want our practice to be more in line with the evidence, then you move to the next phase, which is adapting or customizing the evidence to the local context. So if it was a practice guideline, what do you need to do to the practice guideline to actually make it work in your context? You can't change the recommendations because they're based on evidence, but how you deliver them might be slightly different from place to place, for example. Then once you've done that and you know exactly what you're implementing, you need to figure out what the barriers and supports are to the implementation of that evidence. And then once you know what those barriers are, you can actually select and tailor implementation strategies or interventions to overcome those barriers. And then you need to be monitoring the uptake of the use of the evidence, and also looking at the outcomes or the impact of what happens when you actually use the evidence. And then the last box that you see sort of at 5 o'clock is the sustaining knowledge use. And while it's placed at the end of the cycle, really the model has you thinking about sustainability issues from the very beginning, because it's too late if you wait to the end to then say, oh, what are we going to do to sustain what we've done? So that's the action component, and that came, as I mentioned, from the 30 models. What was missing from some of those 30 models that we looked at was the knowledge, the K2A. Where did the K come from? And so we built in what looks like a triangle on the figure, but it's actually intended to be a funnel that's filtering the knowledge. So that's the knowledge creation funnel. And so there's primary studies, first generation knowledge, knowledge synthesis, second generation knowledge, and then knowledge products and tools is the third generation, the more refined information that would actually be used, or what you would hope would be implemented or taken up in practice and in policy. So those are the two components of the knowledge to action cycle, and that's how you get the K being the knowledge creation and A being the action.
Thank you for sharing those pieces of the knowledge to action framework with us. My next question for you is, can you describe what makes this framework especially well suited for planning pragmatic research?
Sure. To start with, though, I would say that it's really well suited for pragmatic implementation. And that was really the intent of the planned action models and the knowledge to action framework. But having said that, it's also useful in the research context. So KTA is intuitive. The phases often make sense to people, whether they're researchers or clinicians or managers or policymakers. Healthcare providers in particular see similarities with the knowledge to action process and the healthcare process. So starting with, you need to diagnose and assess, then you would be treating and managing, you'd be monitoring progress, evaluating outcomes, considering maintenance. So these are common elements in the healthcare process as well. It requires thinking and attending to the local context and collecting local data. And so this really does make it pragmatic, because what we know about implementation is it's all about context. And so when you think of the phases, the evidence practice gap phase, or the adaptation phase, or the assessing barriers, or tailoring the implementation strategies, or the monitoring and evaluation phases, each of those phases, you actually, to make it happen, you need to focus on collecting data around the local context. And so that makes it quite practical, because people understand their local context and allows them to have buy-in, as opposed to somebody's just telling them they need to implement something. They're figuring it out for themselves. KTA also is a roadmap for collective action. So to do it requires groups working together. And we know that implementation and implementation research are usually team sports, or should be team sports for them to be successful. because it's a framework as opposed to a theory, it's also easy to integrate other theories into all of the phases. So KTA is very theory inclusive. For research, it can be used to situate where particular studies are focused in terms of the knowledge to action phases. So where does the study fit in terms of the bigger implementation or knowledge to action picture, which can be very helpful for allowing others to understand how the research, what the research is targeting and how it fits kind of the big picture. And maybe I could give you an example of how it's used. I figured you were going to be asking me that, and it's actually a hard question because I know how we've used it and I know how colleagues have used it, but in terms of how has everyone else used it, that's a little bit tougher to answer. But there's a study, one study that's been done by Field and colleagues and published in 2014 that actually did a citation analysis and review of the knowledge to action framework. And they identified 149, 150 articles, and nearly half, about 43% of them, only referenced the knowledge to action cycle. But 27% used it to inform the introduction or the discussion. So even there, they weren't actually using the framework, they were just making reference to it. But about another quarter of the papers in various ways actually used it. So 12% adopted it or blended it with another framework. Another 12% of the studies used it to direct the design of the study, and 7% fully integrated the knowledge to action framework into the design and delivery and evaluation of the implementation activities. And a colleague in the US, Jenny Moore, is undertaking a similar kind of analysis in rehab and has identified over 100, I think 50 papers maybe, in rehab that have used the knowledge or cited the knowledge to action framework, and has found a similar kind of pattern. But she's also finding that many researchers are not just citing it, they're actually reporting that they're using it to guide their whole project or components of their project. And that paper should be out later this year. So we know that it's known. Whether it's used or not is harder to know, but it's been cited several thousand times. And so KTA has been used to guide implementation and to guide research on implementation. I know it's been used to frame research, implementation science research proposals. I also have firsthand knowledge that it's being used by graduate students to guide their thesis. And how I know this is every month I get 1 or 2 requests for permissions to reprint the cycle, either in their proposals, thesis proposals, or in their actual thesis. I've been told, and we've done this as well, used it to explain, for example, to managers what's involved with implementation and why the steps are so important, and what needs to be done and how evidence can be brought to bear at each of the steps. And it's also been used to map implementation strategies. So we have a graduate student at the moment who's looking at change agents and taking all of the activities that change agents do and are slotting them or mapping them onto the phases to see, do they do all of the phases or only some of the phases, for example? And maybe if I have time, I'll just give you a quick walkthrough of a particular project that we had. And so this is now as implementation scientists. The Home Care Authority came to us and said they thought they had an issue with leg ulcers because of their supply budget, and invited us in to figure out what to do. And that turned into an 8-year program of research that followed the knowledge to action cycle. And so as scientists, we were obviously interested in the implementation, but we were interested in studying the process. And so for each of the phases, we were actually able to do studies with sufficient quality and rigor that they were published. So we did an analysis of the evidence practice gap, which was actually published. Then when we figured out how common the problem was in this region, the question was, well, were the patients different? Was this rate similar to other jurisdictions? We looked at the literature, nothing was there. So we ended up having to actually do a synthesis of prevalence studies that then informed that the rates were exactly the same in our jurisdiction as everywhere else. We then moved on to adapting the evidence. I think there was something like 30 guidelines at the time. And so that we came up with the practice guideline and evaluation cycle to help the group actually look at the quality of the different guidelines and look at the recommendations and make decisions of whether they could pick one guideline or pick recommendations from multiple guidelines. And we published that. And then that also led to our involvement with the ADAPT process, or developing the ADAPT process for practice guideline adaptation of practice guidelines, and Can Implement, which is another process for helping groups kind of walk through how they would take guidelines up. We did barriers assessment with nurses and family physicians. We did surveys, rapid surveys, fax-back surveys, and we're able to publish those. And then, of course, we have several papers on the main findings, which were around the uptake and the impact of the implementation strategies. And in this particular case, we were able to more than double the healing rate and reduce the cost by, I think, 2/3. So we were able to treat more people at less cost than before we started the process.
Thank you for sharing those. You hit two of my questions all in one, going from when KTA is well suited for pragmatic research, and also going into some of those really great examples there. I want to flip a little bit. Instead of talking about whenever it's well suited, can you talk about some key challenges or pitfalls using the knowledge to action framework for planning pragmatic research?
For sure. So one of the things that we found giving workshops and working with groups who have, and researchers who've been using the knowledge to action cycle, sometimes there's confusion, and the confusion actually originates from the literature, and it's around the term intervention. And so what's the thing that's being implemented? And so being really clear about the clinical intervention or the policy implementation, the policy intervention. So the thing that's to be implemented, the it. And then there's the implementation intervention or strategy. How are you going to get it, the thing, implemented? And so if you just say intervention, clinicians immediately think of the clinical intervention. Implementation scientists think you're talking about implementation intervention. You put the two groups in the same room and there's a lot of confusion about, well, which intervention are we actually talking about? So being really precise about that. And then depending on one's perspective and where you're entering the cycle, so something like a practice guideline is actually a knowledge product or tool that can be implemented. But at the same time, a guideline can also be seen as an implementation strategy for implementing a specific piece of evidence. So again, the need to be really clear about what's to be implemented and how it's to be implemented, and so that everybody is on the same page as they're moving forward. Something else that we've realized is the barriers assessment. So as you see in the figure, the barriers assessment is really intended to be used to identify barriers to the use of the knowledge, the evidence, the best practice, the practice guideline. It's the box on the figure is not intended to be doing a barriers assessment of the implementation strategies. And of course, you may want to be thinking of what are going to be the challenges of actually implementing, audit and feedback, or the education, or using opinion leaders, or whatever your implementation strategies are. But that wasn't the original intent of the barriers assessment. The barriers assessment was of what is it going to take to implement this particular piece of evidence or this guideline, what's going to get in the way of it. Similarly, the tailoring of the implementation strategies is meant to be about tailoring or mapping the identified barriers. What it is that's going to prevent people from using the guideline, we don't have enough time. So what's the intervention, the implementation intervention, to counter that or neutralize it so that people will be more inclined to actually try it out without just saying, oh, we can't do it, we don't have enough time. A few people, 2 or 3, and it's only happened in the US when I've presented, get fussed about the knowledge to action cycle starting at the bottom and remind me that clocks start at 12 o'clock, and so it should be tipped around the other way so that you start at the top. So it's not actually based on the face of a clock, and so people shouldn't be fussed with where the beginning is. In the figure, you will notice at the bottom around the knowledge creation funnel, there's little arrows going to the left and to the right. And in the first paper that we had a dotted circle all the way around the knowledge creation. And we realized that people didn't appreciate that knowledge creation funnel is to rotate. So right now, it's pointing to the no-do gap. So what's the evidence that's going to address the no-do gap? But if you moved it to the left so that it was the end of it was pointing at the adapt knowledge to the local context, there may be primary studies, synthesis, knowledge products and tools relevant to that phase that you may need to take into account. And so if you kind of moved the funnel to each of the phases, you could be thinking of all of the other external evidence that's out there that may come to bear. And then I gave you the example of we actually needed to do a synthesis. So we were creating new knowledge under knowledge synthesis as part of trying to implement. And let me see what else is there. Yeah, there's a process. There can be process challenges. So to use the framework well, it actually needs a team effort. And our experience has been that sometimes the people who've been assigned to work on the implementation or the research project may not all have acquired the skills to be effective team members. And so it's not so much about the framework, but about those using it. But we've also found that even if the group, when they come together to use it, may not have all of those skills, the framework actually helps them and helps the team to build capacity to work collaboratively because it provides a map that they can follow. So it gives them a common understanding of the nature of the problem or the research project, and so that actually helps. So the bottom line is, when people are using the knowledge to action framework with a group, you do need to be paying attention to team functioning and how to support that to maximize their ability to use the framework. And I guess the last thing that I would say is that overall, we've not seen in the literature, so people haven't written about major issues or challenges using the framework or being that critical for that matter. And we haven't heard about any insurmountable challenges using the framework. What we have heard from researchers and others who use it is that they say that they find it useful and helpful. But I guess the caution would be, as is always the case, there may be challenges that people have and they just aren't telling us about them. So we don't really know.
Awesome. Thank you for going through all of that with me. That's all the questions that I have for you today. So I want to thank you again, Dr. Graham, for taking this time to speak with me and answer some questions about the knowledge to action cycle.
Well, it was a pleasure, Jordan. Thank you for inviting me and being interested in the knowledge to action cycle.